Good afternoon, everyone. Welcome back. Thanks for joining us. We're glad that you're here. I'm Steve,
And I'm Scott.
and together we are Backyard Musings, the Science and Technology channel.
Yep, and we're talking about another health topic this afternoon. This one has to do with your mouth and all the good stuff that's in your mouth, and it's doing a lot of harm. It's not just causing cavities. So here we go.
A bacterium best known for damaging gums may also be involved in the hardening of the heart's aortic valve. Preliminary research presented at the American Heart Association's Basic Cardiovascular Sciences Scientific Sessions 2026 points to a possible biological connection between chronic periodontal disease and a serious heart valve disorder. The condition called calcific aortic valve stenosis, or CAVS, develops when calcium accumulates in the aortic valve, causing it to thicken and narrow. Because this valve controls blood leaving the heart, the narrowing can restrict circulation throughout the body. Would you like to know more?
Okay, calves may cause no noticeable problems at first. As it advances, however, patients can develop fatigue, chest pain, shortness of breath, fainting, heart failure, and premature death. None of those are good.
No.
Severe cases are generally treated by replacing the damaged valve because no medication has been proven to stop or slow the disease. The researchers identified a possible pathway through which long-term gum infection could contribute to valve calcification.
Quote, there are currently no medications proven to prevent or slow the progression of calves. We hope our findings demonstrating the link between periodontal disease and calves will stimulate further research into new preventative and therapeutic approaches for this condition, said co-lead author of the study Chen-Yang Li, medical doctor and PhD candidate in the Department of Cardiology at the State Key Laboratory of Cardiovascular Disease of Fuwei Hospital's National Center for Cardiovascular Diseases, the Chinese Academy of Medical Sciences, and Peking Union Medical College, all in Beijing.
Wow. I wonder what he does for a second job. That's pretty crazy. Okay, the investigation occurred on, here we go.
Centered on
Porphyromonas gingivalis. P. gingivalis, we'll call it that. A bacterium that plays an unusually influential role in gum inflammation and the breakdown of tissue supporting teeth. Previous research has also connected P. gingivalis with inflammation beyond the mouth and with cardiovascular problems. I've heard this, actually, including plaque buildup inside arteries and coronary artery disease. That history made it a plausible candidate for examining the possible link between periodontal disease and damaged heart valves. So take care of your teeth.
Yes. The researchers first turned to human tissue for evidence. They measured bacterial levels in heart valves removed during replacement surgery, comparing samples from patients with calves with samples from people who had other valve disorders.
The goal was to determine whether particular microbes appeared more often in calcified valves. P. gingivalis was not the most common bacterium detected, but its presence differed sharply between valves affected by calves and those without the condition.
The human tissue findings could show an association, but they could not establish whether the bacterium contributed to calcification. To explore that question more directly, the researchers moved to experiments in mice.
The researchers exposed mice to either live P. gingivalis or bacteria that had been inactivated by heat. Then they examined whether the microbe accumulated in the aortic valve, increased calcium deposits, and produced signs resembling aortic stenosis.
Some animals received antibiotics to test whether reducing the bacteria would change the outcome. In another group, the researchers genetically removed or disabled the inflammatory pathway involving interleukin-1 beta, that's IL-1 beta, which is a signaling protein produced mainly by immune cells. It helps trigger inflammation, the body's response to infection or injury, but excessive or persistent activity can also damage tissues.
Repeated exposure to live P. gingivalis caused the bacterium to build up in the aortic valves of the mice. The animals also developed more valve calcification and stronger signs of aortic stenosis. Preventative antibiotic treatment reduced those effects, but still no cure, right? Just reduced.
Yeah. Inside mouse valve cells, P. gingivalis activated interleukin 1 beta, providing a possible explanation for how infection could encourage calcium buildup. The researchers then removed IL-1B genetically. Even when P. gingivalis remained present, the mice developed substantially less valve calcification and fewer symptoms, suggesting that the inflammatory pathway played an important role in the damage.
The results do not yet show that P. gingivalis causes calves in people. The human tissue analysis identified an association, while the experiments demonstrating a possible mechanism were performed in mice. Quote, the key message is simple: take good care of your oral health, Lee said. Good oral hygiene and treatment of periodontal disease are important for overall health and may also have benefits for cardiovascular health. While it is still too early to recommend specific treatments for preventing calves, our findings suggest that periodontal health could be an important piece of the puzzle. So, I don't know if we talked about it before, but I get my teeth cleaned 4 times a year. And because I went through this stuff, not the stenosis and issues, but I mean, I didn't take care of my teeth for a long time. And yeah, so I go, I don't have to go, but my prior dentist recommended that I get my teeth cleaned at least 3 times a year. So I just bumped it to 4. And comes a little bit comes out of my pocket. Well, a lot of it does actually because of my age and stuff. But yeah, it's helped a lot. So yeah, I had no idea when I wasn't taking care of my teeth. I had no idea that your gums and stuff happening in your gums and in your mouth could affect your heart or circulation. So yeah, take care of your teeth.
All right, folks, thanks for joining us. We'll catch you in the morning.
Take care, everyone. Have a great day. We'll see you tomorrow. All right, man.